Mold and mycotoxins. Have you been exposed to mold and mycotoxins? Do you have mold sensitivity? Do musty odors bother you? Have you worked or lived in a building where the air vents were discolored? Have you noticed water damage or discoloration on ceilings or elsewhere? Has your home been flooded? Have you had leaks in the roof? Do you experience shortness of breath? Do you experience recurring sinus infections? Do you experience recurring bronchial infections and coughing? Do you have flu-like symptoms? Do you notice an increase of symptoms on rainy days? Do you have frequent headaches? Are you fatigued and have a skin rash? A person's hypersensitivity response to mold and mycotoxins is accurately determined through individual intradermal screening of each mold. Molds are skin tested one at a time, so an accurate treatment dose can encompass both skin response as well as symptom response to each individual mold. Several species of the most allergenic molds are also skin tested and treated to afford the patient more complete coverage of the mold's allergic potential. There is another dimension to mold exposure. It is the exposure to the chemical or mycotoxin produced by many molds. There are over 400 mycotoxins, most of which are cytotoxic. These fungal toxins are volatile organic compounds, which are similar in structure to ketones, aldehydes, alcohols, and aromatic and aliphatic hydrocarbons. These fungal chemicals can be acutely or chronically toxic, depending on the kind and amount of toxin exposure. These fungal toxins are lipid-soluble and thus can be stored in organs and tissue, producing serious health effects. These effects can include skin and pulmonary infections. They can be toxic to the liver, kidneys, and nervous system. They can suppress the immune system and can be carcinogenic. Thus, mold exposure is spore exposure, which can elicit allergic responses, and chemical exposure, which can be linked to organ damage. The Environmental Health Center Dallas is a leader in the field for recognizing, diagnosing, and treating exposure to mold and its mycotoxins. We use accurate and concise laboratory analyses and diagnostic procedures to determine the effect of mold and mycotoxins on all parameters of the patient's health.